The Ebola epidemic is now capturing the entire world. Certainly overseas, they are now more concerned than ever before, seeing the disease that has mutated and also needing money and people in order to fight Ebola. What's happening now in America is interesting, simply because the president would like to send money to fight Ebola. However, there is still a discussion that here in America, diseases here, hospitals here, are bad enough for people, and diseases are caught here. Should we not be dealing with this first at home? And why is America the one sending a tremendous amount of money to deal with what is now and could possibly be the pandemic that everybody so fears? Let us now talk a little bit more about this as we welcome into MidPoint. She is the former Lieutenant Governor of New York State and a health policy expert. A pleasure to welcome Betsy McCaughey. Dr. McCaughey, good day.
Well, thank you. It's good to join you, and we all feel tremendous compassion for what the West African communities are going through, struggling with Ebola. It's killed about 2,100 people so far and likely will kill thousands more. And the president has announced that he wants to spend $200 million fighting Ebola. Well, that seems oversized compared with what he's willing to help patients and hospitals with. He has allocated a puny $30 million to stop the superbugs that are raging through American hospitals, killing over 23,000 people a year, killing them year after year, killing them right here at home, killing our parents, our spouses, our children in these hospitals. So if the president is ready to fight infectious disease, we need the help.
Betsy, what kind of diseases are we talking about here specifically?
Well, we're talking about CRE, which the Centers for Disease Control and Prevention calls the nightmare bacteria. We're talking about Clostridium difficile, which many of your viewers know about because someone in their family has already gotten it. We're talking about the dreaded MRSA, MRSA, or VRE. These are all drug-resistant bacterial infections you get after you go into the hospital. And the single biggest risk factor is what room you're put in. It's the luck of the draw, but the fact is, if you're put in a room where a preceding patient, somebody who's already left, had one of these bugs, your risk of getting it is double. And disinfecting these rooms should be the #1 priority. That's why the hospitals need money.
Well, all right, now wait a minute. I'm going to ask specifically on that because as more people go into the hospital, everybody is under the assumption, assume is always a difficult word in any business, but people are under the assumption that when they go into the hospital room, it is cleaned, it is disinfected, the bed linen has been changed, everything has been gone through, and they are ready to go ahead and be there. Please do.
The research shows that over half the surfaces in a patient's room are left untouched when one patient is discharged and the next patient is put into that room. So if someone treated in that room had one of these dreadful superbugs, you are in line to get it. That is the truth. And the fact is that the same $200 million could outfit over half the not-for-profit hospitals in the U.S. with the equipment that's already available. Hydrogen peroxide misters, xenon ultraviolet machines. We have several technologies that will literally eradicate the superbugs from these hospital rooms, but hospitals don't have the money to buy them.
Is it fair to say, and again, you just touched on that. Here you go. You're right on it. But when it comes down to money here, we're talking about hospitals here. We're not talking about just the places that are storefronts, but hospitals themselves. Here comes another assumption from the American patient themselves. They believe that hospitals are well funded, that hospitals have enough money to get the job done, and that hospitals know exactly what they're doing with what they have. What you're telling us right now is that the hospitals want to be good at what they do, but they don't have the money.
Yes.
So how do they then get the money, and why are we not giving it to them?
Oh, yes. The fact is the for-profit hospitals are doing really well under Obamacare. Their profits are way up, in some cases up 50%. But not-for-profit hospitals are skating right near bankruptcy, many of them. And it costs somewhere between $80,000 and $125,000 to buy one of these machines that disinfects hospital rooms in a matter of minutes between patients. Now, it pays off very well because treating these hospital infections, these horrible superbugs, add about $35 billion a year to the nation's healthcare tab. They're not only deadly, they're expensive. But the hospitals still need upfront help buying these machines. And if the president is willing to step up and stop infectious disease, I hope he will lend a hand to the hospitals and patients right here at home.
All right, now I'm going to play devil's advocate here, of course, as many people will when it comes to a situation like this. You're going to look at Ebola, which, as I pointed out, possibility, there's always a possibility that could be the global pandemic that so many people are worried about, that could circle the globe in no time. I mean, we've seen certainly the movies about it, but indeed, it can happen. It is a possibility. There are those who will say that America is the only country that has the wealth, if you will, and the ability to get in here, throw that kind of money at the problem and have it make a difference, because other countries simply don't have the money and can't make it happen. So, in the end, long story short, America is the only one that can do this to stop something that could kill a lot of people around the world.
Well, let me just point out, Ed, I hear your argument, but the fact is these other superbugs, CRE, C. diff, they're already here, and they're already killing thousands of people a year. So let's get busy to curtail these deaths right here in our hospitals.
Then why? That's going to be the basic question I can hear on everybody's lips. Why is then there 200 million going to fight Ebola and only 30 million here? It has to come down to somebody making decisions here, Betsy.
That's right, and the wrong decisions are being made in the White House. That 30 million is what the president put in his budget, and he's got to make fighting infectious disease here at home at least as high a priority as fighting infectious disease halfway around the world in sub-Saharan Africa.
What then is it going to take? Let's get down to that, because we're talking money, and you've already detailed a lot of what happens in the hospitals. We're talking about $30 million, I believe, going to American hospitals right now. Let me make sure I got my numbers right. $30 million. What do they really need?
Yes,
are we talking about 300,
million.
200 million? Where are we?
Well, 200 million would outfit half of all the not-for-profit hospitals in the United States. You would see the death toll from these superbug infections plummet, saving tens of thousands of lives. And I know we have the support in Congress because a couple of weeks ago, there was a hearing in Congress, and one of the strongest voices for more help on this issue was Bernie Sanders, a very far left Democrat from Vermont. So this is not a Republican issue. This is not a Democratic issue. When somebody in your family has one of these hospital superbugs, you want help.
Then why, here we go again, we got to come right back to it again. Why then would the President of the United States then not give enough money to American hospitals in order to care for Americans?
That's right. That's the question I'm asking. Why doesn't he show the same concern for Americans as he is showing for the sub-Saharan Africans? I just want him to show as much concern for our families dying in hospitals right here from infectious disease.
So with all that we have here then, Betsy, what is it that the American patient can do? I guarantee you there's people sitting out there right now who are getting ready to go to hospital, may wind up in hospital soon. And we've now pretty much thrown a scare into them about what they're going to be getting from some of the hospitals. So what can these folks do?
Let me say what they can do. First, number one, come to our website, the Committee to Reduce Infection Deaths. It's at www.hospitalinfection.org. We will help you get ready for that hospital stay. If you're visiting a loved one in the hospital, forget the candy and the flowers. Bring a canister of bleach wipes and wipe all the surfaces right around your loved one's bed. You could be saving their life. Those germs lingering on the bed rail, the over-the-bed table, the privacy curtain, the call button, those are killing patients in our hospitals. Inadequate cleaning is the problem.
I got about 30 seconds left. How much of what we've talked about here today floats down to Obamacare's fault, if any?
Well, in fact, Obamacare has very little to do with this, except that it is putting the not-for-profit hospitals on the financial ropes. So they're laying off cleaners, laying off nurses, the very people we need to protect patients from infection.
That is indeed what many people have talked about. It comes down to jobs and what exactly people can do now and the kind of health care that they're getting. I think that has a tremendous amount of people scared. Betsy McCaughey, I know that we possibly have scared some people here today, but unfortunately it's something that has to be talked about and something that needs to be brought into the light today. I thank you so much for giving us a little logical thought on it as well.
Thank you.
All right. It is worth pointing out as well that some of the studies that come out regarding what's happening here at American hospitals, and this is a study that comes from Time magazine, also comes from the 54th Interscience Conference on Antimicrobial Agents and Chemotherapy. I know it's a long list and a long line here, but you at least have to listen to it. This is data on gram-negative bacteria from 1998 and 2011. Through that time, this is a drug-resistant bug called gram-negative. Each day spent in a hospital increases the likelihood of a drug-resistant infection to a patient by an additional 1%. Doesn't sound like a lot, but it can cost one life. That's too many. Later on this hour, another day and another interesting note about Obamacare from those who insist, no matter how it's painted, a plan that is working. Devil and details to follow and so much more when MidPoint continues.